Knee osteoarthritis is a degenerative joint disease characterized by the breakdown of cartilage in the knee joint, leading to pain, stiffness, and reduced mobility. It is typically progressive and can have a significant impact on people's lives. Let's learn more. Take a look.
My osteoarthritis knee pain really kind of started for me in my early 50s. Maybe as an athlete, you're used to kind of having some, nagging injuries or frustrations, and it's just kind of part of playing. When I started to feel the knee pain, it was more of a burning feeling. Walking up the stairs to go to the first tee at a course that I'm a member at. And like, left foot, then bring my right up, left, then bring my right up. And sitting in a chair for maybe an hour and a half just on my computer, and then getting up, it's like, okay, I gotta, let me regroup this to get up. And then you'd limp a little, and then you'd be able to walk for a little while. So it was, again, little things that eventually add up. It was now time to find a solution, find a way to ease the pain and find out what I could do to be comfortable, to be able to do the things that I enjoy doing. Walking, working out, playing golf, skating with less pain.
Joining me now is Jason Rand, a physician assistant from Boston Bone and Joint Institute. Jason, by the way, has extensive experience diagnosing and treating a variety of orthopedic conditions. Welcome, Jason.
Olga, thank you for having me.
Let's just talk about knee osteoarthritis. What is it, and what are the symptoms?
Knee osteoarthritis is a degenerative condition that affects joints throughout the body, particularly the knee, considered a wear and tear of the joint. The symptoms of knee osteoarthritis include pain, swelling, soreness, and lack of function. Patients often report the inability to walk a long distance or stand for an extended period of time. Stairs can be an issue. Getting up in the morning, the knee can be sore, stiff, and those are all signs of degenerative condition of the knee joint.
And let's be honest, the quality of life, I've seen my stepfather where it's just debilitating.
Absolutely, and that can affect a person's affect, their mood, lead to depression, affect their cholesterol, blood pressure by not moving.
Who is at risk? I mean, is it just a result of aging?
So this is a common misconception about as we age. Knee pain is not normal. It's a pathology. It's a diagnosis. So they should see their healthcare provider and get an understanding of that. So we're at risk of osteoarthritis of the knee with obesity, with experiences such as traumatic injuries to the knee joint when we were younger. Certainly, as we get older, the risk of arthritis increases as we wear out the articular cartilage surfaces of the joint.
So when someone is diagnosed with this, what is usually the standard of care, Jason?
So the standard of care is to start with conservative management, such as weight loss and strengthening, which are paramount to offloading the joint and protecting the joint with good muscle. Beyond that, you move into oral anti-inflammatories, and also to round out conservative management, injection therapy of corticosteroids.
I know for a lot of people, anti-inflammatory drugs work, but for many, they just can't take it. There's some risks involved as well, correct?
It is true, and these anti-inflammatories are easily accessible at your local pharmacy, but they come with risks.
Right?
There are certain patients that cannot take these non-steroidals because they're on blood thinners, or they have irritation to their stomach, which presses us to find solutions for these patients.
You mentioned injections. Tell me about those.
So injections are a mainstay of treatment for knee osteoarthritis. Traditionally, we use glucocorticosteroids to relieve pain within the knee. There are some limitations to that, however. While these injections work, they are short-lived in terms of benefit.
Are there other options available today?
There are other options, and science has been great to innovate in terms of these injections and move us forward to providing better relief for our patients.
And you're going to be sharing more of that innovation, so stay right there, because when we come back, we're going to talk about new innovations out there for you if you're dealing with this. And also, Mike will be joining us to talk about how he found his way to living well with less knee pain, which is what we want. We'll be right back. Stay tuned. We're back with physician assistant Jason Rand from Boston Bone and Joint Institute. We've been discussing the impact of knee osteoarthritis, knee pain, and the challenges that come with managing it. Also joining us now is Mike Eruzione, who we met in the video at the top of the show. Welcome, Mike. So nice to meet you.
Nice to be here. Thank you very much.
No, thank you for sharing your story. You know, I wanted to ask you, Mike, Tell me the difference, I guess, you felt with the pain in that knee that you had maybe as an athlete and when you started noticing, wait a minute, this is a little different now.
Yeah, well, I think as an athlete, you're used to having soreness, you know, muscles aching, body bruises or whatever. And I was a baseball, football, hockey player, so I played a lot of sports growing up. And it was kind of in my early 50s that I realized that something was wrong. You know, something was not right. Something was very uncomfortable. And I knew I had to do something. And I was able to finally contact Jason after trying different kind of treatments. Nothing was really working.
And let's talk about that relief. What is out there now for patients?
So we've been limited in terms of our management of osteoarthritis. A lot of what we have at hand, including corticosteroid injections, are short-lived. And ZILRETTA is the first and only FDA-approved treatment for osteoarthritis knee pain that uses extended-release microsphere technology. The benefits and risks of repeat injections have not been demonstrated. ZILRETTA is an injectable administered by a healthcare professional. It's a novel treatment with a unique delivery mechanism. ZILRETTA microspheres slowly and continuously release medicine into the knee for about 3 months. After injecting ZILRETTA into the knee joint, the microspheres break down and turn into carbon dioxide and water, which are naturally found in the body.
Mike, you received the ZILRETTA injection. What was your experience?
It made such a difference, you know, being able to do the things that I wasn't able to do before with less knee pain. Walking, playing golf, skating, sitting on an airplane, getting off the plane and being able to walk off the plane. So, I mean, it was just incredible, the difference. And the biggest thing was, you know, able to do the things that I love to do with less knee pain.
That's fantastic.
And Mike was at the end of the road. He tried every modality that other
Which is
physicians,
what a lot of
PAs
people
have
do.
tried. Absolutely. And they're faced with the decision, do I live with the pain? And what ZILRETTA did is it gave Mike another option for knee osteoarthritis pain.
Now, I'm sure ZILRETTA has been studied. What is it telling us?
Yes, ZILRETTA has been extensively studied. In the main clinical study, a single injection of ZILRETTA reduced osteoarthritis knee pain for 3 months. About 70% of patients had no to mild pain at 3 months, with about 60% experiencing no or mild knee pain at 4 months, or 16 weeks. In a small clinical trial of people with controlled type 2 diabetes, minimal elevation in their blood glucose level was experienced after treatment with ZILRETTA versus a short-acting, immediate-release corticosteroid. Corticosteroids may increase blood glucose levels. Individual patient experience may differ from what was seen in this study. As with any medication, there are some risks of side effects. Some of the most common include joint pain, headache, joint swelling, back pain, sore throat and runny nose, upper respiratory tract infection, and bruising. ZILRETTA is contraindicated in patients who are hypersensitive to triamcinolone acetonide, corticosteroids, or any components of the product.
That's fantastic. So how's Mike today?
Mike's great, you know, playing golf like I love to do, you know, being able to skate with the grandkids with less knee pain, helping out with our high school hockey team and skating around the ice with them is kind of fun now and enjoyable with less knee pain. And that's what I was looking for.
Fantastic. Thank you so much. So appreciate you sharing your story.
Thank you.
Appreciate it. Keep on with the fun.
Thank you.
Thank you for the information as well, Jason. And if you'd like more information and to find out a provider in your area, visit ZILRETTA.com. And as always, you can go to our website, accesshealth.tv.
ZILRETTA. Indication and important risk information. What is ZILRETTA? ZILRETTA, triamcinolone acetonide extended-release injectable suspension, is an extended-release corticosteroid approved to manage osteoarthritis knee pain. The benefits and risks of repeat injections have not been demonstrated. Who should not receive ZILRETTA? You should not receive a ZILRETTA injection if you are allergic to corticosteroids, triamcinolone acetonide, or any other component of the product. What possible side effects of corticosteroids could occur with ZILRETTA? Rare serious allergic reactions. Effects in the injected knee, such as infection, with pain, swelling, and restricted motion, or joint damage. Increased chance of getting an infection and a decreased ability to fight an infection. Effects on hormone production. These effects can be reversible. Elevated blood pressure, sodium and water retention, and potassium loss. Intestinal perforation if you have certain gastrointestinal disorders, weakening of bones, changes in behavior or mood disturbances, increased pressure inside the eye. What are the most common side effects of receiving a ZILRETTA injection? In multiple clinical trials, the most common side effects seen in people taking ZILRETTA were joint pain, headache, joint swelling, back pain, sore throat and runny nose, upper respiratory tract infection, and bruising. What should you tell your doctor before receiving a ZILRETTA injection? Tell your doctor about all of the medications you are taking, including both prescription and over-the-counter medicines, and about any medical conditions, especially if you have high blood pressure, heart disease, ulcers, diverticulitis or other gastrointestinal disorders, kidney problems, diabetes, glaucoma, behavior or mood disorders, and/or infections. What should you tell your doctor after receiving a ZILRETTA injection? Contact your doctor if you develop a fever or other signs of infection, have an increase in pain along with swelling of the injected knee, restriction of joint motion, or a general feeling of discomfort. Contact your doctor immediately if you are exposed to chickenpox or measles, or for any new or worsening changes in behavior or mood. These are not all of the possible side effects with ZILRETTA or corticosteroid medications. Please see the full prescribing information at www.zilrettalabel.com/pi.pdf. Always contact your doctor if you have questions or experience any side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.